Hello, and for my last story today. And before I start, please hit that subscribe button, hit the like button, share if you think I'm doing a good job, and please comment down below. Now, a lot of people have been saying it's been a pandemic, and finally, the World Health Organization says it's a pandemic. The COVID 19 viral disease that has swept into at least 114 countries and killed more than 4,000 people is now officially a pandemic. This is the first pandemic caused by coronavirus. Uh, World Health Organization Director General Tedros uh, said in Geneva. I'm not going to try to say his name because I will butcher it. Even as he raises the health emergency to the highest level, Tedros said hope remains that COVID 19 can be curtailed and urged countries to take actions now to stop the disease. I think some of the countries are saying, let's have it, let's see where it goes, because it's past what we can do. He also said, "WHO has been in full response mode since we were notified of the first cases, and we have called every day for countries to take urgent and aggressive actions. We have rung the alarm bell loud and clear." No, you haven't. If you rung the alarm bell loud and clear back in December, you would have said, "This is major. Stop all travel from China." That would have been a loud and clear ringing the bell. But no, you had to bow down to China's and their markets. 8 countries, including the U.S., are now reporting more than 1,000 cases that has affected 120,000 worldwide. In the past 2 weeks, the number of coronavirus outside of China has increased 13-fold, and the number of countries has tripled. It's, it's like 100, uh, about I think 180 countries in the world, and 114 are affected. Hmm. In the days and weeks ahead, we are expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. Well, the last one you can't really climb that much higher because you'll run out of countries real quick. The World Health Organization is deeply concerned both by the alarming numbers of spread and severity and by the alarming levels of inaction. No one wants to take action. Taking action is change. People don't want to change. We have therefore made the assessment that COVID 19 can be characterized as a pandemic. By dubbing COVID 19 a pandemic, the World Health Organization is placing it in a difficult categories that severe, several recent deadly outbreaks, including the recent Ebola outbreak in the Democratic Republic of Congo and a Zika virus outbreak in 2016 and a 2014 Ebola outbreak in West Africa. All three of those outbreaks were deemed to be international emergencies. The last pandemic, the H1N1 influenza, killed more than 18,000 people in more than, oh, well, there's 214 countries. So you got at least 100 more countries to go, according to the World Health Organization. Uh, they're also saying what a lot of people have been saying, don't panic, use your head. In Italy, more than 630 people have died, and the total number of cases continue to rise. The country now has 10,000 cases, only second to country There are 9,000 cases in Iran and more than 7,700 cases in South Korea. I personally think China, Iran, and South Korea is vastly underestimating, either through not to look bad, they stopped testing, or they ran out of test kits. And those Italy, Iran, China, and South Korea all imposing drastic measures to attempt to slow the spread, which has a higher fertility rate among elderly and those in poor health. Those countries have also made more than 90% of the current, and they have 90% of the current cases. And he's trying to say China and South Korea is lowering the rate. No, I don't think so. Uh, in the Americas, Honduras, Jamaica, and Panama are all confirming canola- coronavirus infections for the first time. Elsewhere, Mongolia and Cyprus are also reporting new cases. As the outbreak has ballooned, so has speculation that the World Health will declare a pandemic. The CDC um, has said these things to try to slow it down. Wash your hands with soap and water for at least 20 seconds, using hand sanitizers, and only wear the face mask if they are sick or caring for someone who's sick. If you're sick, don't go out. Stay home for make sure it's not that. Uh, Sorry, this one was a long one, but it was kind of important. I also suggest you guys stock up on some food, some water. Make sure you have all your meds for about a month. Make sure you don't have to go to the pharmacy where probably more and more people are going to start going when they start getting sick. Uh, oh yeah, wouldn't hurt to buy an extra roll of toilet paper. And as always, be safe. Bye bye.